Thank you, Chairman. I'd like to thank our witnesses for taking the time to be here today. I know that we all share in the commitment to making sure that our service members, both abroad and here at home, are taken care of. Military relies heavily on local communities to provide access to health care to our service members, especially in areas where there is limited on-base care. This is particularly true for bases where Defense Health Agency has planned to restructure or close hospitals and clinics as part of the recent efforts to reform how the DoD provides health care to both active duty and non-active TRICARE beneficiaries. The Defense Health Agency plan hinges on a community healthcare system that can provide essential services in a timely manner to both service members and civilians in need of care. Recently, Ridgecrest Regional Hospital, which supports service members stationed at Naval Air Weapons Station China Lake, announced that they would be suspending their labor and delivery services due to unprecedented financial challenges. This loss in care means our service members at China Lake will need to drive almost 2 hours to the next closest labor and delivery unit, which places an incredible hardship on our service members and their families. Ridgecrest Regional Hospital is just one of 55 critical access hospitals within a 40-mile radius of a military base. These critical access hospitals are federally designated as essential to providing healthcare services in rural communities. I'm incredibly concerned that with the continued impacts of COVID-19, significant healthcare professional shortages, and low reimbursement rates, these hospitals will not have the resources they need to continue to provide services to our service members. Question for the Navy and then all branches. Master Chief Hone, I know that Navy is tracking this issue, and I'm wondering if you have identified any possible solutions to leveraging existing Navy or DHA resources to support community hospitals that provide critical healthcare service to our military. If nothing has been identified at this time, does the Navy have an interim plan to support any pregnant service members or spouses at China Lake? Is it possible to provide labor and delivery care on base? And then I'd like to open up the question to anyone else on the panel who might have similar concerns.
Congressman, I thank you, sir, for your attention and understanding of a problem that's happening in Ridgecrest. It's a small community, and that it has your attention gives me a lot of comfort to understand that it's not just us paying attention to this problem. The transformation of the Defense Health Agency has relied largely on being able to access medical care outside our military fence lines. And that transformation was based on assumptions that existed prior to COVID. And then just as you described, many of those assumptions are no longer viable or no longer exist outside our military fence lines. And that is manifesting itself in different ways in different locations. Pregnancy, delivery, obstetrician services available in Ridgecrest. We have similar problems up in the Bremerton area, where we used to have somewhere in the neighborhood of about 15 clinics that someone could go to. Now there are 3 on that peninsula that are no longer accepting any new TRICARE patients. So our service members and family members are having to drive down to Joint Base Lewis McChord, an hour and a half or so away. What we're doing in those locations, Ridgecrest, there was a lot of discussion with our Bureau of Medicine and Surgery and our Surgeon General, and along with the administrators of that Ridgecrest Community Hospital to do all the things necessary to keep them open, not just for obstetrician services, but across the board. And we're making a lot of headway in solving what those problems are. Specifically to somebody that is a pregnant service member, but also other things that we're no longer able to provide and feel confident in providing that medical service care to that individual. We're looking at that place like we would any other remote location or overseas location where medical services are restricted. And we'll have to restrict assignments to those locations until we can provide that medical care. Perhaps relocate service members who need that type of care so they can deliver somewhere else. And that's going to have to be across the board until we get this all solved. This is a departmental issue. It's not something that's Navy specific. Our Deputy Secretary of Defense has tackled this on personally and is helping us solve our military healthcare system.
I appreciate that, but we had this fight a number of years ago over Lemoore, the base closest to my home, and they shut down the facility there. They're leaning on the hospital in the city of Hanford, which is only a 15, 20-minute drive away. But as we see this continuing in many rural communities across the country, I mean, just in my district alone, we've had 2 or 3 different hospitals close over the last number of years. And if it wasn't for one larger hospital outfit coming in and saving a couple of them, we wouldn't have the resources there. And it's frustrating to see across all the different branches. And I don't know if anyone else wants to add to this or what they're seeing in their area.
Sure, Congressman, I'll take the opportunity to also agree with my teammate here. We're struggling in this space. We recently just came to an agreement with DepSecDef to surge our medical service members into our medical treatment facilities to help cover down and shorten times it takes to be seen. And it's just another example of what we're doing inside with uniformed personnel for the Army side of the house. Our combat medics, there's a balance between the amount of time they spend working inside the clinic, because there is goodness there when they're actually working on medical skills, but then how much time they spend with their warfighting unit preparing for their wartime mission. And so there is this tension. We also see this in our MEP stations, in our entry processing stations also, where we're struggling and we're trying to surge medical personnel also to ensure we don't lose any potential recruits.
The opportunity is there to, Sergeant Major?
Sergeant. It's part of, it's the all-volunteer force, right? So we promised that to the family member and the service member. I think that's where you're going with it, sir. It's dangerous. It's to recruiting and retention when they don't see it. It's war fighting. The service member is not focused, right? Because they're worried about having to go further away. They're not at work. They're not fixing an F-35 engine. They're not doing live-fire ranges, and they keep falling back further and further in training. So there's some issues to be resolved for sure, sir, and appreciate you bringing that forward.
I imagine, I've got someone in my district right now that she is due, the day before her husband is due to return home. And if she's going to commute to a hospital alone and have to drive hours, that's not going to make life a lot easier. And I imagine the warfighter is not sleeping well, not focused on their responsibilities, and not doing the best they possibly can to fight for our nation, knowing that their family isn't being taken care of. So I appreciate the concern, and Chairman, I yield back.